the question is whether it is related. The answer will be yes and also no. So they are linked in a little way, but not completely correct. The easiest way to look at it is that if a patient has diabetes, high blood pressure, high cholesterol, they are more likely to get a heart attack. They are also more likely to get a stroke. And same if you're smoking. If you're a smoker, you are more likely to get both. But it does not mean that a patient with a previous heart attack will definitely get a stroke or more likely, because there are many causes of stroke. Heart attack is very simple. There's only one cause, which is a blockage of the artery. If the patient has a blockage of the artery, there's a chance that he has blockage of other arteries in the body, including the ones going to the brain, and therefore he's at a little higher risk of stroke. But stroke has many other causes. For example, patients with irregular heartbeats, what we call a condition called atrial fibrillation, or AF for short. The heart rate becomes irregular, the heart develops small little blood clots, and these travel to the brain and cause a stroke. It is not due to an artery blockage. They can also have other rarer reasons for stroke, which I don't think we need to go in, but it is not related. Okay, but yes, it is related in the sense that some patients with artery blockage, they have blockages everywhere, not just the heart, because the body will not just choose the heart to have cholesterol deposit. If the cholesterol has gone into the artery, it must have gone into the arteries elsewhere, including the arteries going to the brain. If we treat the patient with heart disease, we are aware that they are at slightly increased risk of a stroke, but most of them will not have a stroke in their lifetime. The risk is higher, but it's a very small risk. So we will want to control the risk factors that I mentioned: stop smoking, control diabetes, cholesterol, high blood pressure. And same for a stroke patient. If we see a stroke patient, we will also want to check the heart to make sure there's no blockage there, if the stroke was due to an artery blockage. But if the stroke was due to something else, then we will need to treat that cause, for example, the irregular heartbeat, and then give the blood thinner accordingly to which is the cause of the stroke.